Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
If the patient has minimal or mild pain, then we will have to treat it like primary dysmenorrhea. So we should give NSAIDs with oral contraceptive pills are given. NSAIDs with oral contraceptive pills are the first line pills and they are continuous with 3 months they are continuous for 3 months with 7-day pill free interval. If this NSAIDs and OCPs, if these fails, then we give progesterone. Progesterone is a second line drug where there is residualization and atrophy of endometrium is seen. Example of progesterone which can be used in endometriosis is Denogest. Denogest is a fourth generation progesterone which can be used in endometriosis. If even this does not work, then we go to the third line drug which is gonadotropin releasing hormone agonists or antagonists. Even if these fail, then we do a laparoscopy and do surgical management of pain. So in the third line, we give gonadotropin releasing hormone agonist and gonadotropin releasing hormone antagonist is given. So in gonadotropin releasing hormone agonist, the most commonly used gonadotropin releasing hormone agonist is leuprolide. Leuprolide cannot be given orally. It is given through subcutaneous route or intranasal route. The side effect of gonadotropin releasing hormone agonist is mainly related to decreased estrogen like hot flushes or osteoporosis. These are mainly done to prevent the add back therapy. Low dose estrogen is given along with gonadotropin releasing hormone agonist mainly to prevent the osteoporosis. Dose of estrogen required to prevent osteoporosis is much less than the one which is required to support osteoporosis. So
Dose of the estrogen required to prevent osteoporosis is less than the dose required to support endometriosis.
which is required to support endometriosis. That is, the dose of estrogen required to prevent osteoporosis is much less than the dose required to support endometriosis. So, in order to prevent osteoporosis, we can give low dose estrogen with gonadotropin releasing hormone. Gonadotropin releasing hormone antagonists can also be used, like most commonly cetrorelix is used. Newer drug is uh, elagorix. Other drugs like letrozole. Letrozole is an aromatase inhibitor which is used in combination. Danazole is a testosterone derivative. It acts like a progesterone. It is not used. These both letrozole and danazole are not used because of the side effects like hirsutism and acne.
thank you and thank you for watching.